Hello and welcome Health First Health Plan members. I want to thank you for being proactive about your bladder health. I would like to share with you a recent event that I did on urinary incontinence and how you can take control of your bladder. Viewers of this event were able to ask questions, so I encourage you to watch the entire event to see if your questions are answered. Thank you.
Hi, my name is Carrie Andreu. I am a urogynecologist here at Health First. I have offices here in Viera, where we're at right now, and then also at Gateway. I want to thank everybody for joining in for our talk tonight. It's pretty informal, and what we're going to try to cover, the topic being breaking up with the bathroom. So we're going to just have more of a conversation. I'm going to go over some of the more common types of urinary issues, urine leakage, go over briefly what causes them, and then some things that we do to treat them. This is just to kind of keep me on track, and then also to give you an idea. You know, we follow a pathway that kind of helps us in the management of all of these conditions. So I'll start by just saying that urinary incontinence in general is very common. You know, it's all I do, and I have you know, 2 other people here that do full-time urogynecology as well. So all we do is urinary incontinence and prolapse. So that's how many people deal with this on a daily basis. I'll give you a little bit of my background. I did a 4-year residency in OBGYN. I did that at the University of Cincinnati. I then did a 3-year fellowship in just urogynecology. So that specializes in just prolapse, so pelvic organ prolapse, and urinary incontinence. So if it's leaking or if it's falling out, then we can fix it. And then worked in Arkansas for about 5 years there in a private practice setting, and then came here. Dr. Tu, the other urogynecologist here at this office in Viera, and I trained together, so I came to join her. And I've been here coming up on 2 years. So to start with, we'll just kind of go over the 2, I guess, main types of leakage. And usually I talk a lot with my hands, and I usually have a lot of pictures and props, so I'll just try to kind of be descriptive. But there's 2 main types. There's what we call stress incontinence, and then there's what we call overactive bladder. So I'll start with stress incontinence. Stress incontinence is a muscle problem. So essentially what that means is that when you put physical stress, not emotional, but physical stress on the bladder, so you cough, you sneeze, you exercise, you pick something up, anything that puts pressure on that lower abdomen, what should happen is that the muscles in the vaginal area should be able to clamp down around that bladder so that it doesn't matter if you're jumping on a trampoline with a full bladder, nothing's coming out. So age, wear and tear, all of those things can, you know, wreak havoc on those muscles. So, you know, I see women of all ages. So there are some 20 and 30-year-olds that, you know, after pregnancy and childbirth, you know, especially if they've had twins or a particularly traumatic vaginal delivery, they can have some issues with stress incontinence. And then menopause is another big culprit. So, you know, the loss of estrogen can cause a real decrease in the muscle mass in the vaginal area, among other things. And so that's another time where stress incontinence in particular becomes an issue. So that's what stress incontinence is, or some of the symptoms that are associated with it. So then how do we fix it? So I'll move through the treatments, kind of going from most conservative to most interventional. So to start with, stress incontinence is a muscle problem. So